Good evening. I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and tri-state community. It is my absolute pleasure to have our guest here, Dr. Efrat LaMandre. She's a nurse practitioner. She's a doctor of integrated medicine, and she has a private practice out on Staten Island, and someone who I've had a lot of experience working together with on our patients, and we've had many patients in common. And you're going to really try to, I hope, going to bring us a different perspective to Conversations in Medicine about how we take care of patients with a more of an integrated medical technique. So first and foremost, I think you're president of the Nurse Practitioner Organization on Staten Island. So tell us a little bit about nurse practitioners.
Sure, that sounds like a great plan. First of all, thank you for having me. I really appreciate it.
You're quite welcome.
So nurse practitioners, for those of you who don't know, they are nurses first, and then they go back to school. Typically a 2 to 3 year program, and they specialize either in family, geriatric, pediatric, psych. There could be more, so don't hold me to that. And during that schooling, they learn if nursing is more about taking care of the patient and carrying out the orders, this is more about diagnosing and putting in the orders yourself. So in New York State, we have nurse practitioners after 3,600 hours of practice are able to practice
About how many years is that?
I guess it depends on how many hours a week you work. Right. So if you're really dedicated, you could probably finish it in a year and a half, but typically 2 to 3 years of working under someone's guidance. You can then go on to practice without a collaborating physician in New York State. It's actually true for about 50% of the states at this point. So with that degree, I have a degree in family, as a family NP. I opened up EG Healthcare. And that is how you and I know each other.
Yes.
So I'll continue on. So EG Healthcare is located here in Staten Island. If you don't know it, you should check us out. It is primary care, pediatric, adult, and we also have a geriatric house call department. And it is a medical practice, primary medical practice, just like any other on the island.
So tell me about home care. So you have people, nurse practitioners, going to people's homes?
Right. So we discovered, of course, with COVID, that there were so many patients who needed primary care in the home. And of course, that continued after COVID. So you can imagine, over 65, various degrees, perhaps of disability, and getting to primary care is really difficult. And as we know, primary care is really about prevention and screening and making sure that we're getting the basic medication for chronic illness, and getting to a medical office is quite difficult. So we opened up a house call service where we send the NP to the home so that they can take care of the patient. Everything that would happen in an office is now happening in the comfort of the patient's home.
So blood work.
We could even order x-rays, we can even order EKGs in the house, and then of course coordinate if the patient needs additional ancillary services, we can coordinate that as well. But it's been a real game changer, not only for the patients, but honestly for the families that are taking care of the patients. It's so much easier.
No, that's a tremendous need, and sometimes even as a neurologist on Staten Island, we have so many patients with multiple sclerosis who really can't move, get out of the house, people with Alzheimer's disease, Parkinson's disease, really with neuromuscular problems where they can't walk. It's a tremendous service. I know there are a couple out there, but it's marvelous to hear that you guys are doing this, and something that I think everyone should take advantage of. I think it really would be very helpful for the caregiver also. As you said.
Yeah, it's helpful for the caregiver. You're right. It was so many of the caregivers are in that age where they're taking care of children, taking care of their parents, and being able to have a service like that is coming to the home is just, it's powerful for the whole family.
And I'll ask you in an interesting way, some of the data that we see with patients with Alzheimer's disease, the caregiver doesn't take good care of themselves. And many a time they'll even pass away or have more comorbid illnesses than the person with dementia or Alzheimer's disease. So if you go to the home, could you take care of both people? Could you take care of, so they don't have to meet certain criteria to be taken care of at home?
Well, there are certain criteria, of course, dictated by insurance. As we all know, we're all, are at the mercy of those criteria. But many times our NPs, I'm not the one delivering the care, but many times our NPs will take care of the spouse as well, exactly for that reason.
What a wonderful thing. So we're going to go into the topic we were going to talk about, and that's inflammation. Now, I asked you, what would you like to talk about? And you said, let's talk about inflammation. So inflammation is a broad topic. As a neuroimmunologist, I think of inflammation in certain ways where the body attacks itself, or various autoimmune disorders, or things that we've seen on television with all the commercials for psoriasis and various other disorders, where rheumatoid arthritis, and even for MS now, there's a lot of commercials. So tell me, what's your definition of inflammation? And through your integrative medical care, how do you treat it, and how do you think about it?
Sure. So this, I just want to give a little bit of background about that, right? So this kind of integrative piece and where I got my Ph.D. in is a little bit of outside of the box thinking, and it came from a personal journey through, my wife's illness, where we really felt the parameters of conventional medicine were not getting us where we need to go. It's amazing and it's necessary, but sometimes you need a little bit more. And that is why ultimately I got my Ph.D. in integrative medicine. And I developed a company called The New Method. By the way, new is spelled with a K because you always knew there was a better way. Anyway, so I can't help it. Okay, so what we see is that inflammation is at the heart of everything. Now, the list that you just gave of various diseases, that is actually at the end of the spectrum of inflammation. When the patient's already diagnosed, already in your care, already has a name of a disease, that's actually end-stage inflammation. But what happens to the patient who just doesn't feel well? Aches and pains, brain fog, memory issues, energy issues, and they go from primary care to primary care, and everybody's wonderful and everyone's amazing, and they're constantly being told that everything is fine. Their labs are fine. They have no diagnosis. So you send this patient home really disempowered, but I don't feel well. But, my stomach hurts. I still have brain fog. I still have aches and pains. It can't, but, I did everything right and everything is negative. That's actually the beginning of inflammation. So inflammation is a constellation of symptoms. On this side of the spectrum, it's this constellation of symptoms where I would categorize it as unwellness, but not sick yet, right? That's where inflammation starts. You have, I feel great, I am well, and you have, I'm sick. And there is a huge spectrum there, and that is all pushed forward with inflammation. And where you come in is at the end stage of inflammation, where many of us come in. I can give you a medication here. I can do some rehabilitation here, or something that I could do to help you manage the disease. But so many patients here are kind of left waiting as they marinate in this inflammation.
Is there a test? Is there any way you could define this?
That's a really great question. So of course there are some tests for inflammation, CRP, ESR.
And we'll just use words for our viewers. So those are biomarkers in the blood, which basically we're able to test to see if there is some inflammation. And and various disorders, things like autoimmune disease, will have an elevated levels of these markers called sedimentation rate or C-reactive protein. So they're just names of blood tests basically that we have.
Right, so these are names of blood tests that we have to capture inflammation. But the problem is, again, if the patient comes in and is not feeling well, and those are negative, they are left feeling invalidated. And so my contention is that inflammation starts with the symptoms, even if you're seronegative. Even if your markers are negative, whether they're autoimmune markers, whether they're inflammatory markers, if you're not feeling on point, you're inflamed.
Do you think a lot of the symptoms that you're describing could also be seen with people who are depressed?
Yes, there seem by people depressed, but then there's that chicken egg, right? So did the depression come first and then they're unwell? Possibility. Or are they so unwell and constantly getting messaging that something's wrong with them? Hey, there's nothing wrong with your blood. Your lab works fine. Why don't you just get up and exercise? Why don't you just lose 5 pounds? And so eventually, but you're like, I really don't feel well. Eventually, you're going to get depressed from that. And I think there is a vicious cycle there as well. There's going to be a bit of a chicken egg there.
No, and I think some of the science, even in my field of neurology, we know now that diseases like Alzheimer's disease have an immunological basis. And when they start is about 20 years before the patient has any symptoms. Same thing with Parkinson's disease, same thing with multiple sclerosis. The time of highest inflammation is actually the year or two before the diagnosis is made. So we see this throughout everything. With regard to heart disease, people with coronary artery disease, or myocardial infarctions, heart attacks, people will oftentimes, many a time, if you actually look at the plaque that comes out, there's a lot of inflammation in there. And the word inflammation, for me, talks about white blood cells, almost like your body is attacking an infection. So that's like there's certain chemicals that come out, we call them cytokines, all fancy words. But we're seeing this in almost every disease process. And we're also seeing, maybe you could enlighten us a little bit, about cancer patients. That with cancer patients, we're using immunotherapy now, not just chemotherapy, which is diffuse therapies that knock out any dividing cell, but immunotherapies, things that go after just the right cells that are causing this, and we use the immune system to get it activated to reduce and shrink and actually even sometimes cure cancers.
Absolutely. So you've touched on like 3 huge topics, right? So let's try to go through them. So first, Alzheimer's, and everyone's really scared of Alzheimer's, and of course, rightly so. And you really nailed it when you said it actually starts years before, right? So by the time you're diagnosed and failing the memory test, it's pretty far gone. But again, with that spectrum, what happens with brain fog? That we're saying, oh, I just can't find my phone, I'm so busy, and but this is actually the beginning. This is a spectrum. These are the warning signs. And if we start looking at that through the lens of inflammation and what inflammation does to the immune system, and we can start treating those symptoms, what could we do to improve that brain fog? We can hopefully prevent that spectrum from going forward and developing into full-blown Alzheimer's, right? And you know that Alzheimer's, certain types of Alzheimer's is actually called type 3 diabetes, right? That same inflammatory standard American lifestyle that brings type 2 diabetes is now associated with Alzheimer's. So we have the brain. Then you mentioned the heart. Same thing, we're also worried about cholesterol. We're so fixed on cholesterol, but in that cholesterol panel, there is an extra line there, so it's CRP, which is that inflammatory marker, because we've come to appreciate that cholesterol alone is not enough of a marker. In fact, if you have an inflammatory marker, if your inflammation is up, it actually puts you at a higher risk than just cholesterol alone. So if you have 2 people with the same cholesterol, the person with inflammation is at a higher cardiovascular risk. So the role that inflammation plays in heart attacks and stroke is so significant. And then you touched on the third scary thing, which is cancer. Again, inflammation plays a huge role. It plays a role in developing a cancer because it creates, we have the inflammation, which it creates an immune response, which can, of course, exacerbate things. But then if we are already managing and treating, if we're not calming down the inflammation as well, there's a higher level of recurrence. So there is not a chronic disease that I can think of that inflammation does not have a hand in.
Absolutely, I agree with you fully. So let's talk about treatments a little bit. I mean, it's nice to talk about this, and we tell you that things are going on for 20 years beforehand, and what do we do to make it better? So with heart disease and even things like stroke, the category of medicine like statins. So these are cholesterol-lowering agents. And so many of my patients will say, my cholesterol is not really that high, I don't want to be on a statin. And one of the comments that I make oftentimes is that the statin works more as an anti-inflammatory response than it does as a cholesterol-lowering response. We want it to lower your cholesterol, but it really has certain effects on inflammation, large effects of inflammation. But that's really very standard medicine. I know we've talked about it. I know you practice very standard medicine with your medical practice, but a little bit trying to get an idea about some of the things through integrative medicines that our audience would love to hear. Are there any things else we could do, and whether it's low salt diet, weight control, things like that, that you think would have an effect on people who are just listening and just not feeling that great?
Absolutely. So I love that you started with conventional medicine because this is not instead of, this is an addition to. So don't run out and throw all your medications in the garbage, take the meds and do the other things, keep it safe, and hopefully over time you can lower your medications. First and foremost is going to be nutrition. And low salt is not even close to enough, okay? What you want is an anti-inflammatory diet, anti-inflammatory nutrition. So it's not enough to just say, I'm going to be low carb, I'm going to be low salt. If we're playing the inflammatory game, we need to have an anti-inflammatory nutrition. Now, what is anti-inflammatory nutrition? There are some variations, and it really depends on people's starting point. But to keep it simple, you look at your plate, and the first thing you need to see is color. You need to have phytonutrients. Phytonutrients is a fancy word for why your fruits and vegetables have color. So you look at your plate, you need to have color. You need to have greens, reds, yellows. Maybe you don't have them at all the colors every meal, but make sure you have it throughout the day. And then you add a piece of protein to it. If you're vegan, then you have vegan protein. If not, you have a good source of animal protein in there. And then a little bit of fat, olive oil. That's it. That's your meal. Your fruits, your colors, your protein, your fat. Notice I didn't add anything else in there. If that is your plate consistently, you're at the beginning of an anti-inflammatory nutrition. And you have to start thinking of your food. There's only two choices with food and nothing in the middle. You are either eating your food as medicine or you're eating your food as poison. And there's nothing in between. So what you choose on your plate, you make a decision. Is what I'm eating going to lower inflammation, or is what I'm eating going to increase inflammation? So we have nutrition. The second piece that a lot of people miss, because they're ready to eat their grilled chicken and their broccoli rabe, but you have to sleep. If you're not sleeping, and this is the line that I say is, I don't care how much gluten-free ice you're eating. If you're not sleeping, your nutrition's not on point. And you know that sleep plays a huge role in Alzheimer's prevention, and it just plays a huge role in overall health.
The immune system as a whole, of course.
The immune system as a whole. There's a lot that happens at night, kind of like this is when the sanitation department of your brain comes out, cleans things up so that you can be refreshed the next day, and that doesn't happen if you don't sleep. You're shooting for 7 to 9 hours. So we have the nutrition, we have sleep, and movement. Now notice I didn't say exercise. You need to have movement. When I say exercise, it sounds like we have to join a gym. It sounds expensive. It sounds like you need outfits. You don't need any of that. You need to move. And what movement looks like for each person is different. So what you did yesterday, a little bit more today. And if that means that all you could do is walk to the stop sign, and tomorrow you could walk a few steps, that's great. If you are someone who runs, maybe a little faster, maybe a little longer, movement to your level, but every day, and preferably outside, because a lot of magical things happen when you move outside. Supplements help a little bit too.
So tell me about outside. I'm actually listening. It just hit me. So outside, what happens outside?
What happens outside? Okay, what happens outside is a few things. First of all, your brain finds out what time of day it is. And it also tells you what season it is. Because when we sit here, we have no idea.
Right.
And that's a lot of information for your brain to know. In fact, in order to sleep well at night, I'm sure you know this, your brain needs to know that it's morning. It needs to see the sun, because as it knows what time of day it is, it starts to pulse melatonin to get you ready for sleep. From 6 a.m., it's already prepping you for nighttime. So that is one of the things that happens. The other thing that happens when you're just walking outside, doesn't have to be anything, exertive, is BDNF, right? Brain-derived neurotrophic factor is released, which is like miracle growth for the brain. And studies have showed that 10 to 15 minutes of walking a day can help reduce Alzheimer's symptoms. So much is happening. And then, of course, there's just being outside and the way you're breathing. But on a chemical basis, so much is happening when you're moving outside.
So it's better to do that than even to be with windows open and riding a bike in the house. So getting out is important.
Getting outside
and again,
is
I tell this to all of our patients, and again, this is so important from a holistic point of view, that getting outside is important.
Getting outside is so important. I mean, if you can only do it inside for whatever reason, be near a window, that's second best. But, working outside in your basement is probably, it's better than not moving at all, but you are missing a big chunk of it.
Tell me a little bit about COVID-19. You used the word brain fog a few times. So I'm sure my wonderful audience who's listening to is saying to themselves, the word brain fog has become synonymous with post-COVID syndrome. You've explained to us that it really is not. There's just a brain fog that people just don't feel right. They have truly a fog, a cloudiness. And whether it's from depression, inflammation, whatever, it's not making them live their life the way they want to. So tell us a little bit about COVID-19, and do you have any any suggestions for our audience to try to fight some of the symptoms of it? It's one of those very interesting things that happen in my practice. I had a patient today walk in who was dizzy, and it was about 3 weeks after they had COVID, and recently had COVID. And they said, could this be post-COVID? I said, yes. And do I know for sure? No. I have multiple patients who don't have COVID who are dizzy, who have vertigo and balance problems. And as a neurologist, I see that very commonly. There's so many things that could be related, could not be related, and there's no one test that I know of that could tell whether this is COVID related or not. But with just as an idea of treating people who might have, and again, it's very clear that this entity does exist of post-COVID brain fog. What do you do for them other than, is it the same basically anti-inflammatory diet, the walking outside? Is there anything special you do for them?
So I'm going to say this. I would say that it's not just post-COVID brain fog, it's post-viral brain fog. It's just that we have like this interesting experiment in that we have so many people with one particular virus, so we've attributed it to COVID. But I would say a lot of people who had significant viruses or Lyme, significant, intense, intense infectious diseases will sometimes have a post-viral or post-infection sequelae, right? Like these things that happen after the fact. So brain fog is not just for COVID, but so many of us have COVID, so we see it. So I think a lot of it has to do with who you were prior to COVID, right? What was your health status before will determine how hard it is for you to recover. So let's just go for a more obvious case, and then we'll get more subtle. So if you already have, let's just say diabetes and high blood pressure and things that are already inflammatory, maybe you're having weight issues and belly issues, now you get this virus, it's going to be harder for you to recover. It's going to be harder for you to bounce back. Okay, so that's an obvious one, and maybe our audience is saying, well, but I had brain fog and I didn't have diabetes or anything. But I would venture, I would suggest that prior to you having infected, you probably were in an inflammatory state and maybe weren't aware. Maybe you already were dealing with some aches and pains and maybe just not being 100% well. Maybe your nutrition was off. Maybe your sleep was off. And so this was kind of the thing that threw you over the edge. So what do we do for it? A lot of the same, certainly anti-inflammatory, and nutrition, sleep, but we also really target some supplements to help with the repair as well.
Okay, so that's very important. So if I go to my waiting room or anything, not just my waiting room, because hopefully people don't wait too long and they're seeing in a nice fashion, but if you look around the island, if I go to any restaurant, place of worship, wherever, and say, is anyone in this room not stressed? Not many people would raise their hand. So when we talk about inflammation, you have to put the word stress in. So first of all, how do we define it? What do you think about it? Is it happen to 100% of the people and we're just controlling it somewhat? Or is it something in some people we could actually, whether you're a Buddhist and can do meditation and TM all day and reduce stress to the point where it's not a problem? Or is it something that we just have to live with in certain ways, and maybe some of the treatments you could talk about to our audience about what do you do for people with stress? Because again, a lot of people will have some of the similar symptoms that you've described, and is there a relationship between stress and inflammation?
So certainly there's a relationship between stress. So if we're talking about nutrition and if we're talking about sleep, and we're talking about movement, we also have to talk about stress. Now we're all stressed and there is no stress-free life. But what we can learn is how much it will affect us. So whether it's therapy, whether it's walking outside, whether it is meditation, that's not taking the stress away, but it's learning how much of it affects us. And that is the tools that we have to manage the stress. So managing it is super important because once again, you'll be in a chicken-egg situation. You'll be unwell, which will stress you out, and your stress will worsen your unwellness. So it is definitely something that has to be dealt with. If you're asking me what kind of things to do, this is very individual, but there are some known therapies. I don't want to get too into it, but there is some vagal therapies that are done. There's a program called Unite.
It's a breathing kind of therapy also a little bit, where you try to control your respiration, control your circulation, your pulse, things like that.
Sure, you could start just with a deep breath. As soon as you take a deep breath, you are kind of engaging in vagal therapy, and the vagus nerve calms down. And by the way, that is the gut-brain connection, which is a whole other episode I'll be invited to at some point. But so you have vagal therapy. There is limbic therapy that can be done. And then there is just a therapy that we are familiar with, whether it's talk therapy. But whatever it is, really prioritize managing your stress as part of your healing process.
And that's so important for everybody to really recognize that part. I'll tell you what I do. I take my dog out. Her name is Daisy. Daisy's a beagle. We just got her during the pandemic. Somebody abandoned her.
Aww.
At the kennel, a friend of mine called and said, would you take this dog? And I set my kids down, and they took Daisy. And you could see me walking around Staten Island with this dog every day. And it's one of the highlights of my day, and maybe my year, or maybe my life. So we just walk around, and everybody waves to me, and that's one thing that I do to reduce stress. What do you think about animal therapy?
So I was just going to say that not only is that great that you're walking outside, right? But pet ownership has been shown to have significant impact on health. And a lot of it has to do with the fact that they give us a lot of bacteria, which really help our immune system and diversifies our microbiome. So there is so much about having a pet. Stress reduction, helps with immunity. Go get a pet. ASAP.
We only have a couple of minutes left, so I want you to tell us about the gut microbiome. And, because again, everyone is so interested in it. And as I said, we're going to take the 1 or 2 minute approach.
The 1 or 2 minute approach.
That's what we have.
Okay, so the gut microbiome. Oh my God, I'm over here. The gut microbiome. You have a world of bacteria and viruses that live here. There are more bacteria and viruses in here than there is you, which is pretty scary, but they're smaller. And they don't just live there. Without them, you wouldn't be alive. They create hormones. They create the neurotransmitters. They really create all the things that you need to stay alive. So it's very important that there's good bacteria and there's bad bacteria, and you want to make sure that there's a good balance and that you have enough of the good guys in there. You don't let the bad guys take over. That is what microbiome is. And your mission in life, whether it's nutrition or supplements or owning pets, is to help make sure that microbiome stays healthy, because that will ensure that your overall health. Did I manage to do it in 1 minute?
You did it. You did it. You're amazing. And I'm going to do a couple of thank yous and before we leave. And first of all, I want to thank CTV for the opportunity. We've been out here for almost 10 years now. And it's been a true honor and privilege talking to everybody on Staten Island. And this actually is aired all over the tri-state area. I want to thank Helene Buccieri, our acting director, producer. She's come to help us out now and done a tremendous job, and I want to say thank you. I want to thank Sal Marino, the assistant producer, who's really done a tremendous job. David Marcus, our original producer for the show, is still helping out and doing a lot of work with it. And I want to say thank you to him, too, for everything that he does. So with that, I want to say to everyone, stay healthy, reduce your stress, get a dog, think about the dietary changes that Dr. LaMandre mentioned. And really, I think having a good, healthy lifestyle is so crucial. And it's important that your primary care healthcare provider really discuss that with you. So thank you and have a great night.